Have you ever felt like your entire career could hinge on one single exam? Imagine the weight of knowing that one exam, one performance could decide the rest of your career. For Vijay, this wasn't a hypothetical. It was his reality. After 4 setbacks with the AKT and a setback with the SCA, the stakes couldn't get higher. Success meant moving forward in his career. Failure, it could mean the end. What makes Vijay's story so powerful isn't just about the pressure he faced, but it's about how he turned setback into success, how he went and scored 86 in the second attempt of the SCA. This story isn't just about passing an exam, but it's about how to find a way forward when everything is on the line. Let's dive into it. Hi Vijay, congratulations on passing the SCA. Please introduce yourself.
Hi, I'm Dr. Vijay. I'm one of the trainees here in the Wessex Training Deanery. And I'm an ST3 currently, waiting to get a chance to write the AKT. And this is where, as you correctly said, Dr. Kwun, it hinged on me passing the SCA, you see. And absolutely, I was at a point of time where I was planning to stop training altogether because of the setback from the AKT. And I think at that point of time, I said, if I'm going to prepare for the SCA, given that, it all will depend on me passing the SCA, I have to go in all guns blazing, basically. That's why.
What was going on in your mind?
In addition to being a GP trainee, I am a father. So, that pressure was always there. And I was thinking, if I stop training, what next? What do I do next? Um, I had the support of my family, my wife and my family, and they were constantly saying, you shouldn't just give up. You see, if you are going into this SAA exam, more than the pressure of how it will affect the outcome later, think about preparation. Think about how you're going to prepare different, you see, rather than, and this is where I was thinking, I've I've done this practice before. Of course, I was practicing at home, but how am I going to make it different? And this is where I was looking for help because of the feedback I received. One, my time management wasn't very good. And the other thing is I wasn't going into the management aspect. And yes, I was working quite a bit with my trainer at work, but I was just not hitting the mark. And I was thinking, how am I going to do this? And this is where I looked for guidance, and I was thinking, I need to do something different. I had given the SCA previously and was not successful. I said, I need to do something completely different. I've had this structure in my mind where I'm robotic, but still appearing to be structureless when I'm presenting myself. And I said, this needs to change. And this is where I was looking at how can I work on so many things, you see? The added pressure of me needing to pass the SCA to get a chance at writing the AKT to finish training was, it was like a Damocles sword, basically. They're just hanging in there. But I was trying not to think about it. That's all.
For people who might not know the situation completely, how many times you sat the AKT?
4 times. The fourth time, um, I feel in hindsight, I really shouldn't have sat down because I think I just went into it thinking, you know what, I was so close the third time. I'm sure to crack it the fourth time in a month's time. And I think that was my biggest mistake. I think I just went in completely complacent thinking, this is going to be easy. I felt really confident the last time I gave it the third time. So this is going to be fine. But while writing the exam, I realized what a big mistake I'd done. I didn't even have to wait for the results. I kind of knew already. So the thing is, you see, that's the overconfidence working there. I was like, okay, I missed it by 1% or 1.5%. So I should be able to, if I work a little bit on this and that, no one can predict what questions come on the AKT. And it is designed to show how you will perform as a doctor, your knowledge as a doctor, how you can apply this knowledge. And I think I kind of jumped it saying, you know what? my CCT is due in October. I just need to give it in July and be done with it, before I even think. And I think that was my biggest mistake. I think I just jumped into the fourth attempt really without thinking that, uh, um, as in I thought I would be able to clear it. And I think I should have just paced down and said, you should prepare more and then give a good attempt. And this is why. Yeah, but that's why. So four AKT attempts and one SCA down. I was just very dejected, really.
So with the SEA, when you started, what was your score at the time?
It was 65.5,
What was your score last attempt?
86.
Okay. So were you surprised when you got 86?
I was the day of the results. I was seeing numbers everywhere and thinking, oh God, what if I've scored that? What if I've scored that? And self-doubt was being my biggest enemy on the day of the results. But when I saw the result, I was almost shocked to see that score and think, what? Oh, that's very good. So 2021 mark jump, really, it was phenomenal to see that result and think I actually did it. I couldn't think anything else for the day. I really couldn't. That evening, nothing, no thoughts of AKT or portfolio or training. It was just I thought I was not capable of passing exams, and that just turned it around, kind of a thing. I just said, I can.
That sounds like it was a breakthrough because before then you were feeling a little bit down and it was so difficult. But now I can see a brighter Vijay today.
Evan, you were so right. I can't express how happy I was. I was given an extension at a different surgery, which I'm very thankful to my deanery for. And what happened is I was just thinking, tomorrow's my first day. This is the day after the results. I hadn't received the results yet. And I was thinking, what if I'm going tomorrow having failed the SCA yet again? And the moment at 5 p.m. when I saw my result, I couldn't even believe it. I really kept pinching myself, saying, "Okay, you're gonna wake up and realize that it's the day of the result." But oh God, it's such a relief to go into it. I was just thinking, oh, the holidays are coming now. You got Christmas, New Year, and I was thinking, oh, I've got to, go always have that thing at the back of my head. I still have to prepare for the SCA kind of a thing. And when I saw that, I was absolutely chuffed. I was like, oh, you've done it. You don't have to worry about that exam again.
Yeah. So
And it gives you motivation to prepare for the
yes.
next step. It
Yeah.
really does. It's not like, you think, oh, right, I have to do that again. And, this is exactly how I was feeling when I failed the SCA and I failed the fourth attempt of the AKT. And I was thinking to myself, I have two big exams to give. I don't know what I'm going to do. And the just because I have exams, responsibilities at home don't end. You see, you got your responsibility with the kids, you got small children, and home responsibilities. You've got to go to work, things like that. And I was really at a point where I was thinking, I don't know, man, whether I can deal with this pressure. Should I go back to my old job? Things like that. I was just thinking, it was much more paced. Should I just leave the training, and just, be a family person again? Because essentially, for the entirety of last year, or you can say even 12 months, 15 months, I used to finish my surgery, drive home, and come to my study room and just look at the screen without actually absorbing things. Because essentially, what was happening is you're fatigued at the end of a tiring day. You're looking at the screen, but what's driving you to do that is just these, kind of failures and things. You're like, right, AKT. you got your SCA, you got your portfolio to do, things like that. And it makes you go into this quagmire of, thoughts, and you keep thinking, all right, is there anything else I can do? And, you stop believing in yourself when that happens. Yeah, which is why I was like, no looking sideways, looking front. Let's get the SCA done first. And that's why I can't even express how thankful I am. I really can't. Yeah.
Let's dive into what did you do differently. So when you sat this SEA second attempt, Vijay.
I said to my wife and I, we usually take decisions, because it impacts our family. And I said, I really need to prep properly, and I need to do something different this time. And I was searching and I had seen your YouTube video once, and I said, oh, this is different. Let me see. And, I saw the testimonials and I was like thinking, perhaps this is more what I should do. And I said, I'm going to go through it. And what I did was, you have the SCA companion, which is downloadable for free with the advice you were giving, on my email. And I subscribed to that. And I was just seeing that, okay, can I implement this? Can I try? But I really didn't know till I spoke to you, you know? And I said, right, you want to do something different. Maybe this is what you got to do. I said, yeah, go ahead.
Yeah. So I remember at the time there were some issues with your consultation with the eyes and how to readdress it. Tell us a little bit, what did you do to get a good structure, Vijay?
I had to work on my knowledge base. That was definite. Really had to. And I think the consultation blueprint really helps with that. It helps consolidate that knowledge. The other thing is you've created this beautiful flow work, where you have the buckets, different, things. And it's like, right, move from here to here. It's almost like islands kind of a thing. Okay, you crossed this bridge, you've crossed this bridge, you've crossed this bridge. What I was doing previously is I would remember things and I would be like, right, I haven't finished with that. I'm going back to that. And what would happen is it just would turn out to be like my consultation, instead of being a straight up sandwich kind of thing, it was like a minestrone of things. It was like a mix up and mash up of different things. There was like all three courses mixed into one. So there was no structure, you see. And looking at, with we had the flow of things where, you're introducing and then you go for the ice. Trust you me, I think that made such a big difference in my consultation, and I think I still do it. So, where I say, okay, what do you think is going on? What are your concerns? And what do you think I can do for you, kind of a thing. And trust me, that takes such a lot. It almost funnels it down to where you need to go with your consult. And that is so important. And I'd never realized that. And when I tried this, I think I was ending up with more time to give towards management, which really clenched the exam for me this time. I think the additional marks that I scored in the management aspect. So the last time I scored 19, and this time my score was 36 out of 54.
36.
So
Yeah.
it was a big jump. It was a proper pass in there. And you can just notice in the feedback, it's like, I think last time, the first time I gave the SCA was, I just had a few clear passes, that too in data gathering, because I was spending majority of my time data gathering, you see? And I was almost not looking at the interpersonal skills. I'm not caring much in that time. But after using this flow structure, you can see I've got clear passes in all three domains, you see, and the number of stations I've clear passed, unbelievable. SCA attempt one station clear pass. There was one station that was my, something of personal interest, mental health. But this time I had 7 stations where I had clear passes. The blue, basically, not just green. It was like bluish, and it's so good to feel right. You're doing this right this time, and that's where I felt, yeah, that structure, the flow that you have, the initial pages, very important. Yeah.
How did you manage uncertainty on the day of exam?
You've got to embrace it and give the safety netting and things like that. And the first station, trust me, I was thinking, oh no, I've messed it up. But I think what I did at that time was try and make sure I was sure what the patient's not agenda but the expectation was, and work around that when I was managing uncertainty with them, so that they had a clear plan as to what we were doing going forward. And that's what's needed. You need to make sure patient is safe. When you finish your consult, yes, you've managed to, the most important things and the prioritized things, but you're also keeping them safe so that they know what to do if something turns or something worsens and things like that. And that's how I did it. Yeah.
Yesterday, I had a message from one of the trainees who was saying to me that when he was watching his recording, he was feeling unnerved about it. When you were doing that, how did you actually reflect and review?
I think the secret to that is I, d- I can't say it's a secret, but I think you just have to watch it because it does feel unnerving at first. But that is how you can realize how you're doing things wrong. And I think during the one-to-one sessions as well, and during the exam as well, I must say, I noticed myself doing that, which is something I was doing a lot of during when the patient told me something which I was trying to analyze in my head. And if I was unsure, I would always do that, as a way. And I used to think it would show patients that I was thinking, but actually it was basically a manifestation of an anxiety kind of thing, you see. And these are the things you can notice only if you record yourself and you watch yourself and you see there are some things you're doing where you're subconscious of, you're not aware of. And a very good um, friend told me that, always when you record yourself, listen to the audio, listen to the video, and then do it together, watch the video, and then do it together, kind of a thing, you see. And I think that is a good step, and say, what is it that I'm saying is wrong? Because, sometimes it used to happen that when I'm speaking to the patient, they would say something important, a very important cue, and that's your interpersonal skills. And you'd be like, oh, all right. And it would be the wrong response. Essentially, it would essentially be the wrong response. And it would almost be like they're telling me what they want or what is the main thing here. And I would be like, oh, yeah, we can address that later, like kind of thing, almost not addressing or pushing aside, you see. And you come to see that when you record yourself, you kind of say, why did I say that? Because everyone knows when you look and hear it, you can say, oh, why did I say that? That was such an important clue, you see. Because sometimes when we consult, we are thinking, right, where are we going with this? So multiple things are going in your head, and you think, oh, right, okay, where am I going? What's my next question? What do I ask next? Where am I going with it? This is what's going on. And if you record yourself and watch it again, this is where I would say you will understand where you're missing those things that can actually get you those points, can help you manage uncertainty better, so patients walking out of that consult happier, or at least they feel assured that their concern is being addressed. Yeah.
That's great here.
With the interpersonal skills, I think definitely recording helps you sharpen that.
Sometimes people find it difficult to find somebody to practice. Have you got any tips for trainees, Vijay?
It's always good to create a group. And thank you for introducing me to my colleague, which is great, And I would say trying to get a common denominator there in the group, like say parents, you see, where they usually have that life where they look after kids and kids go to bed and things like that. They usually can practice after that, or sometimes even before the kids are, done with the ablutions and things of the day. So maybe trying to find a group that can agree on a common time and making sure you get that practice in. Because when I was first practicing before you told me to, I was almost doing like one session a week, and it was just an hour or so. And I would just practice three cases and say, great, I'm done for that. I've done the practice. And this is how I was thinking that this is adequate. But essentially, trying to get at least, 5 to 6 cases, just practicing good level and getting a proper feedback, always having three people in a group kind of thing. So you have an observer seeing what you both are doing, always helps. Yeah. Having that three-person group, finding a common denominator in terms of time, basically, where you can manage. It doesn't matter if they're parents or not, but it's more of that, we need to meet regularly and do this, you see, and making
Yeah,
sure in a week at least you do 5 to 6 cases, if not more.
absolutely. So it's not just practicing a few cases, but you need to be able to practice good number of cases and also making sure that the quality is there. So now that you've passed SEA, what one lesson from this experience that you will take away with you beyond the exam?
Never doubt yourself is what I would say. I think don't doubt yourself is what I would think, because doubt is the one thing that can reduce your confidence, and especially post three attempts at the AKT and then failing the SEA and failing the AKT at the fourth time. I think that doubt was almost getting cemented in me, where I was thinking, I can't do this, Anyway, I've passed, I've paid for the exam. I'm going to go ahead and do this. Is the thinking that goes with it, you see? So never doubt yourself, is what I would say. Don't doubt yourself. Prepare well, but also believe. And that's where, the message you gave in your the 83, the well-structured module that you have, I would say give yourself that chance, and also watch that video before the exam. That last the motivation day before exam thing. I think it really kind of. I know your motivational messages were there almost on a weekly, daily basis, Erwin, but I think watching that before the exam as well kind of says, give yourself a bit of a pat on the back kind of a thing. You've prepared well, so you're going to do it, but believe in yourself going in there. Don't just think, right, I need to go through the questions, I need to do the safety netting, red flags. That'll all come, but believe in yourself, and that confidence shows. I think definitely, yeah.
If you're in the program, you'll be able to access this video. It's a day before your exam, and make sure you watch this before because it's going to boost your confidence. So, somebody who's listening or watching this up until now, they've been following the content, but they're not sure whether they should join the program. Maybe they're a bit on the fence. What would you tell that trainee, Vijay?
Oh my, do I have things to tell you, Erwin? I don't. I've lost count of the emails I sent to Dr. Kwan. How many times saying, you know, what if this happens? What if this happens? Because that's self-doubt, you see. And I would say, I'm so glad I went ahead with the program. I am so glad for it, because another colleague of mine who I was talking about this program for, unfortunately, they suggest they didn't go for it. We said, okay, why don't we? You They go for it their way, okay, so they have access to it, and I go for it my way, and I have access. And they didn't clear, you see, and it was their third attempt. And I told them this is a program that there are testimonies where doctors are saying that they've tried it, and especially IMGs, and the number of emails I was shooting to Irvin saying, I'm really not sure, will I get a chance to do this again, will I get a those kind of things. And I think sometimes, you know when it with the options that you give with the monthly pay and things, I think 3 monthly divide, it really helps where you have this, and the amount of videos and the amount of guidelines, the cases, all of this, I think it really helps, and it's really worth every pound. Yeah.
Thank you so much for sharing your story with us, and I wish you all the best.
Thank you. I was in a different world, almost a different person on the day of the passing the exam. Yeah. And thank you so much, Dr. Kwan. I'm so glad I came across your video and went for it, because I think the self-doubt was keeping me back and saying, oh, do you want to? But I really think I'm so glad that I went for it. You know, I'm so glad and I'm so thankful. Thank you.
You're welcome, and thank you for trusting me in your preparation. It means a lot, and I wish you all the best in the next step now as you're focusing towards the AKT. And if you're interested to join the program, I'll leave a link down in the description. And if you want to get access to the SEA Companion for free, there's also a link there. So thank you very much for watching up until the end. Take care, everybody. Bye bye.